Welcome back. I'm here with my guest, Jules Tupcare, who is the co-chair of the Thunder Bay Health Coalition. So, Jules, we heard a little bit about the decrease in funding and the challenges that we're facing at our hospital here in terms of providing service. What is the Health Coalition doing to try to bring this issue to the fore?
Well, we're trying to, we always advocate, and we're talking to our MPPs and to the Ministry of Health for sending letters through our own Health Coalition and through the Ontario Health Coalition to try and bring the concerns of the people to these people, to the powers, to let them know that there's some concern here and that they should be doing something about it.
And so what are some of the individual areas, maybe not individual, but the areas that you're focusing on in terms of improvements that need to happen in terms of the service here?
Yeah, well, as we talked a few minutes ago about the problems with the hospital and the funding to the hospitals, and of course we all know about the problems at the hospital as far as gridlock and what's happening there. People that are in the hospital that should be in long-term care, and they should be in home care. So we're working with our partners to try and to talk to the province to talk about improving the home care situation and the long-term care situation. Of course, in long-term care, we had the issue a couple of years ago when they closed the Thunder Bay Interim. There's 65 beds in the Thunder Bay Interim long-term care home, basically, which compounded the issue at the hospital. And we raised concerns with the ministry on that, with the LHINs also about that. And basically they said you were allocated so many long-term care beds for Thunder Bay, and the interim beds were only extra, and they were taking those away. So we have reached our max as far as long-term care beds go. And again, that's a concern, especially in Thunder Bay. We have an aging population. The percentage of aging population in Thunder Bay is higher than the rest of the province. Mm-hmm. So we need more beds. And the province has said that they're not going to give us more beds. So we're lobbying to try and get the people to stand up and to join with us, to talk to the province, to the ministry, and to our MPPs to say, you know what, it's not right. We need more funding. We need more care to help our people out.
So the funding for the long-term care beds comes out of the same pot of money?
It all comes out of the healthcare dollars, exactly. Oh, yeah.
Okay, so when they close some of those beds for long-term care, then it starts backing up in the hospital.
That's exactly what's happened, and that's why the hospital's in constant gridlock. They have all kinds of people in the hospital for looking for long-term care beds or alternative levels of care beds called ALC beds, which people that need to go to the hospital. And of course, St. Joe's is filled as the rehab hospital. They are filled, so they don't have any room for these people, so they're stuck in the hospital. Then to keep people in the hospital is a huge cost compared to long-term care beds costs. And of course, the answer by the ministry now is to say, well, we should have people in home, staying at their home.
Okay.
Which again, to us in the Health Coalition, is a wonderful idea. I know if I was ill, if I was incapable of needed care, I would rather be at my home than in a long-term care facility or a hospital, obviously. But we're finding that the funding for home care from the province is way short of what is required.
So what are the issues? I mean, we're hearing, yes, that if we can support people in their own homes, it's going to be more effective, more cost effective as well. What are the issues there? Why isn't that happening, or what is happening in that process?
Well, what is happening is that the province wants to have more people stay in their home, but the issue is how do people stay at home? What we're finding is that the healthcare providers, that the CCAC, the LHIN, of course, it looks over all of healthcare.
The LHIN is the
local health integration network, which is below the ministry, and they're sort of looking after all of healthcare for Northwestern Ontario. And they have designated that the CCAC, and through the government also, looks after home care and long-term care, basically, and basically everything that comes out of the hospital is dealt through the CCAC. And we're finding that the CCAC is hiring providers, businesses that provide home care, but we're finding that there's a lot of people that are getting missed visits. Through our investigation, we found that there's about 100 missed visits in Northwestern Ontario alone a day.
A day?
A day. That the people that require services at home are having their visits missed because the staff aren't available or they're too busy, and so they're missing their visits. And what happens, of course, and doesn't sound all that important if Mr. Mantis, who requires somebody to come by and help him feed him in the morning and at lunchtime or in supper time, misses a meal, well, that's okay. But if Mr. Mantis has diabetes and requires his meals, then it becomes a problem. And we're finding that, as I said, we're finding at least 100 visits a day are occurring, and that is worrisome.
And so you say, yes, that could be a problem. That could be a really expensive problem. If my diabetes takes a turn for the worst, I may be hospitalized with all kinds of complications.
Exactly. So all of a sudden, the idea of having somebody sitting at home, being cared for at home, which is a wonderful idea, then all of a sudden has to go to the hospital. So you've basically negated everything that you've gained by having them stay at home. You've got the problem of bringing them to the hospital and then taking care of them in the hospital. So it's troublesome.
So it sounds like it's a more cost-effective method to help people stay at home, but we're having problems actually delivering the service that's being promised. What's behind that? Do you know?
Well, it's a funding issue. It's the fact that there's not enough money. Now, I know the minister announced a week and a half ago, 2 weeks ago, that there's going to be $14 million given to the local LHINs to try and help the hospital get out of the gridlock. And of course, the gridlock is caused by people that are stuck in the hospital, that don't have home care, don't have long-term care. But again, it becomes, is that enough money? And we don't feel that it's near enough money, because the whole issue of home care is not just providing services to these people, but it's also, they might need accommodation. So like if I'm able to stay at home but I need a wheelchair, maybe my bathroom door isn't large enough to accommodate a wheelchair, so there has to be something done for that. Or I might need a ramp to get into my house, so I can get out of the long-term care home to get me into my home, which is wonderful, but all of a sudden now I can't do that, so I'm still stuck in the long-term care home or stuck in the hospital. So there are all kinds of issues that the ministry hasn't actually hasn't addressed in this whole process.
So it sounds like that lack of funding, where the rubber meets the road, so to speak, is in terms of that frontline service on a daily basis, is coming up short.
Absolutely, and that's the problem. It's always the bottom line, and that's where we're running into problems.
And who provides that kind of service on the home care front? So you mentioned the CCAC. That's what, the Community Care Access Center.
Yes.
That decides how much home care you can get, or what resources are available.
Right.
And who provides that service?
Well, we have a number of agencies in Thunder Bay that provide that. They're private agencies and that hire staff to do these services. The problem that we found is one of the other issues with the whole home care situation is that the staff that work in home care, the wages in home care are not what they should be. The home care workers earn quite a bit less than long-term care workers. So what we're finding is that the home care workers don't have enough money when they're working for home care, so they end up getting a part-time job in long-term care. And then when there's an opportunity to work in a long-term care home for a shift, or a day or two, or a 3-day shift, they will cancel their shift at home care, which leaves the provider agency with a problem in trying to replace that worker. So there's an issue there. The provider agency, they've told us that they understand the issue, but again, they can't do anything more than what they're doing, because the funding that they get from the government to provide these services only allows for them to pay so much money to their staff. So they can't provide more money for their staff, and the staff are stretched to the limit in trying to provide these services.
Well, we'll come back to that really important issue right after this short break.